So we've got 5 fantastic panelists today and a new film to show you. So first of all, I'm going to introduce the 5 panelists and just ask each of them in turn to say just a little bit about just a sentence really of something that has struck them from their organization about the way that they helped to protect people during the COVID pandemic. So the most humane or the most striking thing that's happened to them. So firstly, Carrie from Sheffield Community Contact Tracers. Tell us a little bit about, just for one moment's sort of reflection on the pandemic and how the contact tracers helped people in the communities.
Well, I joined the contact tracers a couple of years ago, and I mean, I've always, through my work, been kind of connected with people kind of across the city, but it was really, really startling how it helped just communicating with different community groups and getting to know community groups on a kind of working relationship in the area where I live, which is the northeast of the city.
Thank you. Next of our panelists is May Connelly from Healy Development Trust. So May, hi.
Hi, thanks, Tom. I think the thing that struck me the most was the strength that was already in some of our communities, but also equally the bits that were missing were really missing. And I think I'll talk more about that in a minute, but yeah, the striking inequality.
Thanks, May. Muna from the Hadfield Institute. You're muted still, Muna, sorry.
I do apologise. So making sure that the message, the real message was clear. There was a lot of mistrust and information that was coming through our communities, particularly the Burma communities that I was working with. So the part that really sort of peaked with me was the fact how community leaders came together, working together, united, and made sure that they were ensuring that the message was clear, working with their communities and being role models, to be honest, key role models.
Thanks, Muna. Wakas. Wakas is from Darnell Wellbeing.
Thank you, Tom. Yes, the contact tracing training, which I done very early when it started, enabled me to get the message, break the barriers through language and other ways, get the message to people with confidence that what is actually mean, what contact tracing and why is needed, and what the message is from government and how it's going to be working in practice. Thank you.
Thanks, Wakas. Lisa from Sheffield Flourish. Hello.
Thanks for inviting us. I think the main thing that we learned through the pandemic was just how fast people got to grips with going from in person to being on Zoom and how fast they picked it up. But we also connected with more people as well coming in through Zoom. As far as the States, people were connecting with our activities as far as the States. And we're getting up at the different time zones as well to connect, because there wasn't the similar services over there than what there were here.
Right, excellent, thank you. Okay, we're now going to be watching the new documentary. This is the second in the series. And Johnny, are you ready to show that to us, please?
I know some of you are hesitant. That's a good thing. That's why we're having this film. So let's who's taking up the vaccine? I've taken the vaccine. Took two.
You took two?
Oh,
Oh,
took two.
fantastic.
Fantastic. Who's not taking the vaccine yet?
The workshop today is about the benefit of taking the vaccine, promoting vaccination within the community, particularly the behaviour community in Sheffield. We have some people, the majority are with the vaccines, and we had a few people who are still reluctant to have the vaccine. So many people came to us, they were very skeptical about this vaccine. And so we had to ensure that the material is translated into, for example, the Arabic language. And also we had conversations to explain to them that we have already taken the vaccine ourselves after all so far, and I don't have any issues with it at all. I think there's a little bit of distrust from the past, trying different medications or many communities, etc. People are already skeptic even before the pandemic, so the pandemic made it worse. Especially when you have a doctor or professor saying, don't take the vaccine, it's a conspiracy, they want to reduce the number of people in the population of the world and etc. They're trying it on people and etc. Some people do believe it.
This is the first time that they give this virus publicity. They scare people in the beginning. People get worried, and so many scientists, even professional people, are giving different views, and people are listening to all over, finding information. Because when you find information, you're not getting the right information. You get information from here and here, and then it's all confusing. So you don't know which one to choose.
I am wary for lots of different reasons. I think the biggest one is there's a massive unknown, and there's lots of questions that are still not being answered by science, by doctors. So until that's made clear and backed up by science, I'm going to remain hesitant probably.
I think of all the conspiracy theories flying around, and social media plays a big part of all these conspiracy theories you hear on social media. But because COVID came all of a sudden, and it was a virus that we've not heard of before, so you don't think to take it as seriously. You just think, oh, some people got it and it was just like a flu to them, and you just thought, oh, a lot of people are just exaggerating it. I was very skeptical about the vaccine and the whole virus at first. I thought it was a big conspiracy theory, until back in December, my granddad, who was very healthy, didn't have any underlying health conditions, caught corona out the blue, and he passed away within 3 days. Now that shook us as a whole family, and since then we've been taking this situation a lot more seriously. We were anti-vaccine before that, and now my grandma, she's had 2 doses and my mum's had 1, because my mum's also vulnerable. She's classed as vulnerable due to health conditions, and I think it's really important that we get this message out to people who are against vaccines. Sometimes you could have COVID and not have any symptoms. Now, you don't know who you're passing that on to, but if you're vaccinated and if people around you are vaccinated, then you're safe. The quicker we get everyone vaccinated, the quicker life can go back to normal.
Feel a bit pressured.
My name is Jam. I know Flourish because I work in the charity sector, and most of my friends that work for Flourish, and they told me about it, that they wanted to get a football group together for people to help improve mental health. It's just a joy that people have when they're playing here, because a lot of them have not played football either ever or maybe not since they was a child, and it's just the pure fun of it. No one isn't really concerned about how good they are or if they make a goal or not. It's just really inclusive. Everyone just tries to make everyone laugh and just enjoy it, and it's just really nice because the rest of lockdown was all quite serious.
My name's Heather. I've been coming to these football sessions since they started, which I think was last year, maybe February time, and I try not to miss one. I come every week. I really struggled actually, so trying to juggle working from home and homeschooling and all those pressures, it's been really difficult, and worrying about the impact on my child and their well-being. So yeah, it's had a huge impact. And there were times that you can see there's some positive points about this, having more time together as a family, but the majority of it was stressful and, like I say, trying to juggle everything. So when these sessions have come back on, I've jumped at the chance to come back to them, and yeah, they've really helped me, and it has a massive impact on my mental health, definitely.
No, we've not had it. No.
Hi,
I'm Amy. I started with the Flourish Football Club last year before lockdown. I was really pleased to hear about a sort of inclusive, mental health friendly club just for women. And then sadly lockdown hit and the club stopped, so not been running for most of the year. I think sport has a massive impact on mental health, definitely. And looking after your physical health as well as your mental health, I think the two are so correlated. You can't have one without the other. And I think particularly with lockdown, not being able to get out and do much. I mean, I'm quite an active person, but it's been restricted, so it's great to just come here, let off some steam. I've mainly been working from home in my job because it's mainly desk-based, so to just get out, run around, speak to other people as well when you're just stuck at home on your own all day. Massive benefits for your physical and your mental health. Coming out of lockdown, I think people are definitely going to be anxious about that, particularly people that have been really isolated and they haven't had any contact with friends or family, and people that have been shielding, if they've been sort of clinically vulnerable. I think definite anxiety about even leaving the house for some people, but I think even people like me that have been lucky enough to still leave the house and go on walks, I think there's still that anxiety around being in big crowds and big groups. I think it's going to take a while for it to be normal and for people to not feel worried at all about COVID. And I think you're trying to find that middle ground, isn't it, of getting back to normal but still not putting yourself in a situation where you're too anxious or worried about COVID.
And I know you don't want to take the vaccine, do you?
I haven't received the appointment yet, but so far I'm not really happy to do it.
Yeah.
Plus, I already had the corona last year, and I don't feel it's really bad. So I felt like it's just normal cold, to be honest. But probably in future, I have to do it anyway. So I asked my family, most of them, my mom and they all done it. So to protect my family, but me, because I already have it, the corona, so I don't feel so bad.
I do food parcel to deliver to all people in our community. We give them like a leaflet in the bag, so they open it and they see. They get awareness about this when they get the leaflet from Hatfield, so they know how to contact to who and to ask about these things going on. And we also have taken vaccine. They said, you have taken vaccine? So I said, yeah, I've taken my vaccine.
Started to work from last year with the corona. I've been doing food parcels to people, the elderly, volunteer, vulnerable families. They got vulnerable kids, drop the food to them. Like quick conversation. Last week when I went to do my parcel, I explained to them that my husband had it, most of my friends had it, my family, some of them, they had it. There is no problem. Side effect, just a couple of days, 1 or 2 days. And that's security is normal. You keep your life safe and the others safe.
Well, I think due to controversies in the media, a lot of people are worried as a person of color. Is that are they trying to eliminate us or use us as guinea pigs? These are one of the most common questions I get asked. And I tell them, I am Black, I've received the vaccine, and I had a mild side effect. And as you can see, I'm okay. So it's just a reassurance telling them it's nothing. Don't listen to what the media is saying. It's just like taking the normal flu vaccine, because every medication obviously do have side effects. It depends on the individual and how you react to it. I may take it, I may react, but you will take it and you may not react. So it's individually, really.
Soup is on this one. We always put them in order. We've got a bite for them, love.
So my name's Penny Thompson. I'm the Centre Coordinator for Longley Four Greens Community Centre, and part of my role is linking in with the local community to have discussions with them to find out what their needs are and to look at supporting the community in setting up grassroots development projects. As an example, such as the food pantry, which is run by local residents in the area. So some of the mental health impacts we had was one of those. The first thing that came about was the isolation. A lot of people felt that being locked in their own homes, they felt very isolated. They felt it was impacting on their mental health because they had nobody to engage with and nobody to interact with. So part of that was discussing with people, how can we help them? The other impacts with mental health was people felt those that had diagnosed mental health felt that they had really good support from the mental health teams, but just felt like, was they on their own in the world? Was it just them suffering? Was their mental health worsening? Was it happening to other people? So it gave them opportunity to meet other volunteers or other members and have that discussion and feel like they weren't on their own anymore.
My name is Quinn Reynolds. I struggle really bad with ADHD and autism and mental health issues. I asked about 12 months ago, would it be possible to be a volunteer for the centre? And I was asked, would I like to run the food pantry? So I decided I'd love to do that, to get more involved in the community, because otherwise I'd be stuck in a bedroom in my house and I wouldn't be out of the bedroom for weeks on end. I wouldn't see nobody and my mental health would get really, really worse. I don't like being isolated. It's really knocks my mental health really down. I'm proud of being where I am now. If it wasn't for volunteering, I wouldn't be here. I'd have probably tried to overdose or something like that because I was that bad. And it's helped me be on a normal balance at the moment. 2 days a week here, it's lovely.
So I think what we can learn from the mental health is we're running a project at the minute called Community Champions, and part of that legacy is to look to lead into health projects. So while we're discussing with the community about issues around have they had the COVID vaccine, we're also trying to identify other health issues. From that, a lot of mental health has come out. So what we're then going to try to do is look at how do we address these needs for the community. So the people who spoke to us about mental health increasing, we're now talking with them is, if you had a package that we could deliver, so whether it be coming in to do yoga classes, whether it be having guest speakers coming in to speak about mental health, is this something you would be interested in? So we're currently going through that process at the moment. This is part of the grassroots development, and then what we would do is react to that to then look at securing the funding to put those projects on.
That's it, let's move around the bags. Stop, 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 B. Stop, stop, B.
So my name's Daniel Barton. I started Mental Mate about 18 months ago. I started it purely down to my own mental health being quite bad at the time, and boxing was something that I used to actually get me through my own mental health bad periods. So we just came up with the idea of Mental Mate. I chose the name purely because I kind of think that everybody should have a mental mate to talk to. Somebody can kind of bounce stuff off and kind of just talk about anything really. So we started the sessions, brought them down here to the Knox Boxing Gym, and kind of the first week the uptake was kind of 10-15 people straight away, and then it kind of grew and grew from strength to strength really. But obviously the lockdown came about and ruined a lot of the plans. That was kind of March, so then it's kind of just been stop start all the time for over the last 18 months.
Solid. That's it really.
A lot more people have joined the session since COVID. There's quite a wide variety of people that come now. People that probably had no mental health issues whatsoever prior to COVID and kind of been stuck in the house, not be able to do what they need to do. In some way, COVID's kind of helped us in a weird way, because obviously we did it just from a mental health point of view, but since COVID's come back, that impact it's had on mental health, got a lot more people coming through the doors now. A lot of it's kind of just kind of depression, stress, anxiety. And there are quite a few issues obviously with people wanting to come, but they're kind of being anxious about leaving the house and things like that. Some of it's isolation. Some people live alone, they've not seen people properly for 18 months. So their outlet is coming down here and seeing the same faces once, twice a week.
So my name is Lauren. I am a receptionist at GP surgery in Sheffield. I've struggled a lot because I lost a friend last year. I found Mental Mate has been really helpful as part of my healing. Having something consistent has been really good. Even when we couldn't come here to the gym, a couple of times we did one-on-one, we did that outside, and that was still really helpful because then you could also have a longer chat. So it's been incredibly beneficial.
Post-lockdown, overall aim really is to have 4 or 5 sessions a week. We want to integrate a kids class into that, ideally once a week as well, and make the classes ideally free or as cheap as possible if funding doesn't allow that. So we already make our Wednesday night free now due to funding, so people can at least access 1 free session a week, and some just come to that session, some will come to both. But I don't really believe that people should have to pay for mental health support and anything that benefits them.
I think with community leaders coming forward, reassuring them, hearing first-hand stories like myself, like if my granddad, unfortunately, if he never had passed away, I would never have understood the severity of the virus. I mean, people need to hear real life stories and just reassurance from people that have had the vaccine that they've not had any horror side effects, like all these stories that are going around. I do believe reassurance, especially within like the BAME community.
I think by showing them this is the right way, the right thing to do, because people are dying. This is a serious problem, we have to, there's no other solution except the vaccine.
Yeah, it's just a vaccine, and it has been tried, and it has been authorized, so there's no problem at all. And people should not feel guilty to promote it amongst people. It's really saving life. And the other point that we do focus on is that preventative is better than cure. So listening to the measures, keeping your social distancing, cleaning hands, and keeping the mask is basically saving many people's lives, but taking it is better than not taking it.
So I think we need to play our part, but I think we also need to convince you, to take your vaccine, and you sit next to me every day.
Yeah. Well, after I hear from Khadija, probably I will do it.
Oh, Khadija!
Family, so I have to protect my family, my friends. So I will definitely do it.
Well, wonderful.
Okay, well, that's our the second documentary that we've made. I don't know if it was just me having a bit of technical problems this end. It was slightly jumpy for me. Maybe it was the bandwidth just here, but so I apologize for that. But it was more widespread than the sort of technical issue, really. So, big thanks to the Sheffield University students and the interns that made that film. Again, it was mostly made during times of lockdown or restrictions, and I think they made a decent go at it, really. So now we're going to talk or listen to the 5 panelists in turn, and first Carrie from Sheffield Community Contact Tracers. Thanks, Carrie.
Yes, hello again. No, I mean, I absolutely take my hat off to the creativity. I mean, it's been a terrible time. It's been a shocking 2 years, and the way the government's handled it has been disastrous. But the way communities have kind of rallied to help people, and the very fact of setting up Sheffield Community Contact Tracers, and the kind of creativity it's unleashed, and it's obvious with the volunteering, listening to the woman from the 4 Greens, the volunteers are there helping other people in their community, but it's being an enormous kind of benefit to them themselves and actually doing it as well. And the guy who set up the Mental Mate, you can see from, he'd been struggling with his own problems, and just by creating that gym. And obviously, I mean, it's quite a complex arrangement and all the people that he's involved. I mean, it's unleashed a whole wave of creativity. I mean, people have talked about key workers, but I mean, the volunteers have been key volunteers and key communities. But I mean, obviously the key issues as well. I ended up watching the first film. I hadn't realized there was a second film until a couple of days back. So I was watching the Tick Boxes film, which was the first one. And that was, I think it was Muna's kind of opening statements in that was about how the pandemic had taken the veil off the injustice and inequalities. And this has been talked about a lot. From a personal point of view, I joined Sheffield Community Contact Tracers in May 2000, so 2 years back. Now, we were trained up as a second batch of volunteer contact tracers, but by that time, the Serco contract for national contact tracing had come in, and the Director of Public Health felt it would be confusing to have two types of contact tracing going on, so we couldn't directly do the contact tracing anymore. But we'd been trained up with those skills, and there was obviously, we did actually in those opening sessions work with other people who were in our own geographical area, and I live in Bungreave. So there were 2 or 3 of us, no, 3 or 4 of us at that point who were interested in doing something locally. And obviously Bungreave is one of the fairly deprived areas of the city. Now, I've lived here for 40 years, so I already had kind of links with community groups anyway. I knew Muna a little bit, but I knew the people down at Firvale Community Hub better. But somebody I was working with, Louise, was more closely associated, knew Muna better. So just as a start at that point, we actually thought, I mean, Muna was talking a bit about the food pharmacy that she was running, and there was a link into a food bank in Firvale as well. But the one thing that tended to be missing with the food banks is, I mean, a lot of it is tinned and dried food. So me and Louise got together and we raised a certain amount of money through individuals and through the trade unions. And for about 7 or 8 months, we actually went every Tuesday morning and we spent 40 quid on fruit and veg. And we took that down to Attercliffe and we took that down to Firvale. And that was really good because it was a kind of, it was very small, and the kind of operation that Muna was running was huge, as was what was happening down at Firvale Community Hub. But it was just everybody contributing a bit of something. And the whole point was linking up with people in the community. And then that leads on to other things. So because of just where I am, and I was going down to Firvale on a regular basis, I ended up working there, and I worked with Usman, who was a young guy who was employed at Firvale Community Hub. And we did a whole lot of stuff around the shops because it was all to do with the social distancing and hygiene and cleanliness and keeping a distance and wearing the masks. So we secured a certain amount of money because there were certain council monies that came in. I never quite think that a lot of this council money actually necessarily gets written down to the right people on the ground. But anyway, we bid for a certain amount of money, and with that money we bought a whole lot of health and safety signage, which we used in the local shops, and that was useful. And the minute you are actually doing something which is obviously helpful, then people open up to you and they talk to you about stuff. And Louise is, I mean, I tend to talk too much, and Louise is a much better listener than me, and she would listen to people. And that became an absolute key thing, that you needed to listen to other people's stories. It is not just your experience. I mean, I'm lucky enough, I, touch wood, haven't actually had COVID as far as I'm aware. So to start with, the big thing was to try and get people tested. So we used to do, I'm quite used to, because I do quite a lot of kind of campaigning out in the streets quite often. And so we, Louise and me then ran with lots of other people who joined us, but we kind of set it up, a Let's Talk COVID stall, and we had that down near the testing centre on Spittal Hill. And so we were talking to people and hearing what their worries were about going and getting tested. And of course, this was something that came up enormously, was because this end of town, the majority of employment is not necessarily very well paid employment. People are not likely to get sick pay. So people don't want to go and get tested because they can't afford to. They can't afford to take time off work. And that was a big one. I mean, that one we were still pushing for. You know, and essential workplaces, which weren't essential workplaces, like places like Pretty Little Things and Amazon, you know, were still open and people were working there in bad conditions. So it ties in with a whole lot of other stuff. You know, you haven't got trade unions in these kind of workplaces to the same degree as you had the teachers' unions, who were very good in terms of managing to get the schools closed down for health and safety reasons for the children and for the staff. But in the poorer jobs, in the poorer end of town, all those kind of inequalities came to the fore, and it was quite difficult addressing all that. But yeah, so we kind of did our bit, and then the second part of the kind of Let's Talk COVID stalls that we ran was encouraging people to get vaccinated. And obviously, the last film, the postcards film, opened down at the Hadfield Institute, and that was a group of people, you know, trying to show to people what the benefits were of vaccines, but totally understanding why people weren't picking up on it. And of course, I mean, several people have mentioned it already in the introductions. The messaging was so shocking from central government. And then, of course, we've got this Partygate bit still going on. But I mean, it was absolutely evident that it was kind of one rule for them and another rule for us, and people were trying to follow the rules and finding it enormously difficult. The messaging was unclear. People were distrustful, and you know perfectly well why they were distrustful, because they distrusted the government, because the government wasn't doing the right thing. So that kind of led on to people being apprehensive about picking up on the vaccine. And then I think through the isolation, it was quite concerning that because people are just thrown back on social media and maybe aren't being able to meet, then they are very vulnerable and open to people, the conspiracy theories. And if you're not trusting, I mean, the woman who spoke, I think that was down at Hadfield, and she said, "I'm a black woman, I've had the vaccination and I'm fine. Don't listen to the mainstream media." But of course, it's very difficult, because it's all very well saying that's the mainstream media you're not supposed to listen to. You mustn't listen to the social media kind of conspiracy theories. So the biggest value of working in the communities was trust. If it was somebody you knew, people that you knew from other work that you've been doing or links that you got in the community, SCCT were trusted, Muna's organisation was trusted, Gulnaz's organisation was trusted. So trust was absolutely key. And even if you didn't persuade somebody first off about possibly having the vaccine, at least if you were talking to people, and at least if you were being helpful. And the other thing we were doing, we bought 8,000 of the little blue masks at one point. And we thought, rather than having the kind of impersonal thing of just having the council as a contact number, we bagged them all up in little bags for all the primary school kids in our area in Burngreave. So there's a little message, and the message said, even if you had the vaccine, you know, you still need to be careful what you do. You still need to wear masks. But it also, as well as being a message for the parents and the children, it was also, so the kind of community networks that have been strengthened through this has been amazing.
Carrie, could I just ask you to wind up now, please, your contribution? Thanks.
Yes, I think so. Well, I mean, just a range of things. I could go on talking forever, but I mean, I think it's unleashed a whole lot of creativity, and it's also unleashed a whole lot of necessity for people saying, we don't go back. There isn't a normal that we go back to. We need to progress on to less inequality, better housing, and improvements across the piece. Thanks.
Thank you, Carrie. And we're now going to move on to May Connelly, who's speaking on behalf of the Healy Development Trust.
Hi, thanks, Tom. Thanks, Carrie. So just very, very quickly overview of what we did during COVID. We set up a helpline within about 4 days. I think we'd sent everyone home. We got the phone number out there. We supported about 700 households, I think, in that initial lockdown part. A big bit of what we did was stuff that we'd already done for 20 years, which is asset-based community development. We listened to what was already there. We listened to what people needed, and we didn't do anything to them. We supported them to get what they need. So if people wanted to do online shopping, the first few times we went and did their shopping. And then after that, we taught them how to do it online. We gave them a device, and we gave them the skills that they needed to support themselves. I think that's really important when we're talking about the impact of COVID which was to highlight these inequalities that were already there, there's also really wonderful communities who, you know, aren't deprived, they are strong and they are resilient and they are creative. And we saw a lot of that, we really did. And the bits that were missing community infrastructure, where there weren't an active community anchor like us, you could see a difference. You know, the mutual aid wasn't there, the networks that weren't there. So yeah, we did support our mutual aid network. We moved then into messaging and education with the Sheffield Community Contact Tracers. We started to put events online where we could. We did one-to-ones outside people's houses, went for walks, things like that. And then we moved into the vaccine response phase of our sort of crisis time. I guess the other thing to highlight is that some of this inequality that wasn't going on, the way that people struggled with their mental health, isn't a crisis. It's not new. We say crisis if it's an acute thing and short term and going to pass. And these things have always been going on. Housing's always been an issue. Access to benefits has always been an issue. Access to healthcare has always been an issue. Trust in some of the systems that we have set up has always been an issue. Supportive environments for children to work at home and do their homework has always been an issue. And I think that we learned a lot from that, in that asset-based community development work, which is what we do, is not funded, it's not properly supported, it's not seen by the government as important, and it doesn't drive policy in the way that it should. And so we supported our community by, one, doing what we'd always done, doing it unfunded, but doing it really well, because, you know, we are part of our community, we live in our community, we know where people are. We knew who was not turning up to the food bank because we were there before COVID, because we were there before the crisis, because we'd been living this for a long time. And I think that the important lessons for them from this is that going forward into this next crisis that we're calling a crisis isn't a crisis. It's something that's always been there. The cost of living has always been important to people. And just because it's seen in a wider audience now, it's a crisis. It was the same with the refugee crisis. It was never a crisis. It had always been happening, and it was always continue to happen. So I think the real takeaway for our organisation from COVID is that we've got to continue empowering people in their own communities. We've got to continue to put the power and decision making in the hands of the local communities. And until we have a truly funded community infrastructure, or give the communities the asset bases to fund their own community work, then we're just going to keep doing it and repeating the actions of the past. Thank you.
That's brilliant, May. Thank you so much. Next of our panelists is Muna Taha from the Hadfield Institute. Hi, Muna.
Hello, hi. I think in terms of Hadfield and ACT, Aspiring Communities, the important part was coming together, working together, seeing many community organisations working together to try and support each other. I think it was really concerning initially what was going on, but the amazing part was how, as different organisations coming together, united, being able to achieve and support individuals. But also earlier on, I said it was also about making sure that the message came across. So for us, it was important that the message came across, and it came across the way that we'd set up the food pharmacy, the telephone helpline, the well-being, the way that the volunteers had come together. And I think the key thing was you could see community leaders wearing more than one hat, not just being behind a desk, number crunching and stuff. I think the challenging time was about us being able to work with our volunteers, with the key workers, and just put those boots on. The amount of times we put the boots on and gone out with them, and making sure that the message was clear, and sharing information, safe information, in the form of leaflets, in the form of volunteers that had been vaccinated, being able to share their experiences and being able to say, look, it's safe. So I think that's, for me, that was really, really key, but also building trust. I think it was really important to build trust and the strong network and contact trace relationship that we had with Jack and Carrie and Tom and Louise. We didn't have it as much as we had, and we built on that, and I think it's a really good working relationship, one that's been built with trust and having a shared agenda and knowing that, you know, we care about our communities and the environment and what was going on in society. And then building the relationship between, you know, the NHS and Sheffield City Council, but also bringing across the fact that community organisations are really and were very, very key to the work that we were doing within COVID and the COVID response. Thank you.
Mona, that's always impressive to hear you. Thank you so much. We're now going to move on to Waqas Hamid from Darnall Wellbeing to say the things that Darnall Wellbeing has been doing during the pandemic. Thanks, Waqas.
Thank you, Tom. Yes, just as first lockdown was announced, Darnall Wellbeing was nearly finishing its 20 years serving the community of Darnall, Kingsley and Handsworth, by providing one-to-one support with health and wellbeing workers, weekly activities, monthly sport groups around long-term conditions, and giving opportunities to people to come and volunteer, all the community members who are 18 and over. And in 2019, we signed a contract with local primary care network to provide social prescribing link worker support, which enabled us to work closely with 5 local GP surgeries in the area. And then what happened is, as lockdown started, basically just a few days before proper lockdown, we decided as an organization that we need to start working from home. So we put our team in 2 groups. One team was looking at for the workers, getting the laptops, getting ready, all the technology, how will work, what we'll do. And the second team was the well-being team, was giving the task to actually compile the list of people we think as an organization, which we are working with now, worked in the past, or we're going to work with, which will come through different routes, and they are vulnerable. The people who come to our groups, we know them. The people we know through staff, we know through our other partners who work with. So we compiled a list of nearly 100 people, and we looked at what could be, because it was new for everybody as us. What could be the barriers? So I looked at the barriers. The language was the biggest one. Then it was the language barrier, the technology, access to food, medicine, because people were told to stay at home. And on top of that, what COVID measures, what government is saying, how to get this message, the right message to people. And that was time then when we went for the community contact tracing, the training, I went by myself. That really helped us to shape our message, because as everybody says, central government message wasn't very clear, but we've been very clear from the beginning how we're going to support. So these are the measures we put in. And through those measures, we had about 100 people on the list, and we kept adding and we started ringing our wellbeing team. They started ringing people, asking how they are, and asked about if they have any question, if they have any issues going on with things. So nearly 300 calls were made every week. And then through those calls, the people were being supported with various different issues. In the same time, we became a designated community hub, which meant that we had a designated helpline where people could ring. So we had more than 1,000 leaflets. We were distributed with our volunteers, our local councillors, our partners, and everybody supported us to do that. And we sent it to people and to ask them if they need anything, please get in touch. We also supported local Roma community through our European settlement scheme, where as they had applied to get certain status, but also that gave us opportunity to connect with them and if they have any other issue apart from that. So we help them. And the type of support we've been providing to our vulnerable citizens, our patients, community members, it was around mental health and well-being calls through activity packs we sent in the post, food parcels via Royal Voluntary Service, local food banks, deliveries of food, medicine delivery, which we were doing through, again, Royal Voluntary Service, cooked meals on wheels type things. We arrange for people, we arrange home visits for people from GPs and local nurses. As a link worker, we had access to, and we had a connection with local GPs where we knew that this is necessary. We went and asked for, especially for these visits. We got transport booked for them through, again, volunteers by Royal Voluntary Service. We're giving them information via phone, leaflets, activity packs, and local language around COVID. At that time, people didn't know how to book. There was a lot of confusion how to book, and people didn't have access. So we booked them the COVID test, later on COVID vaccine. So we spoken to people. We actually had the list from our local primary care network, surgeries, saying we have people who, because of language, because of other things, they don't understand or they're not booking their vaccine, can you help? So we helped with hundreds of people. We gave them ring out. Again, we because of trust, because of experience, those connections in the community, we helped them to get actually, and if somebody said yes, we then booked them for the vaccination. We worked with other community services like Baby Basic. We ran online art therapy and dementia support sessions where people who could come online. We help people to book actually their healthy holidays in summer, where we serve a lot of families, hundreds of families who have young children, where they got meal or the vouchers and they have some activity outdoors. We sent in information in post about long-term conditions, self-management, especially for people who have diabetes or persistent pain or any other long-term condition, to keep them in loop and not to leave them that's just because it's COVID going on. So we've done that. We ran COVID confidence sessions for professionals, workers, community leaders, and volunteers. And with help of community contact tracers, it was really well appreciated. So another thing which we were part of was with Advanced Wellbeing Research Center. They wanted to do a long COVID. Obviously, COVID was going on, then became long COVID, became an issue. And we actually supported them in the research in the local community. And the research was actually around underserved communities. Seldom heard, underserved, these are the names for communities, but these are the people who otherwise wouldn't be able to be part of the research around long COVID. So through Donald Wellbeing, I worked with them where we actually recruited community members who, through different, again, connections, we got to know that they had COVID or some family member who had COVID and they're suffering with long COVID. We recruited them and they were part of research, which now the report is out. If anybody wants, I can send you the copy, which worked really well. And otherwise, those people wouldn't be asked this question. So I would just like to say thank you, first of all, to all organizations which I worked with. And there are a few names: local primary care networks, surgeries, Royal Voluntary Service, local community response team, which was whole council in a way, all people from community support workers to housing, neighborhood offices were involved with that. Food bank, local and citywide food bank, citizen advice, SN4Cs, district nurses, occupational therapy, Age UK, local mosques, where they help us to get there, give information to people around COVID and food deliveries. Volunteers were there with a COVID bus and giving information out. Morrison's gave us food for the local community to the surplus food. Our local CCG, which gave us some funding to.
Well, Marcus, I'm going to ask you just to finalize. It's been fascinating, and thank you so much for for telling us what Dharma Wellbeing's done. It's so impressive. It's fantastic, actually. Our final panelist today is Lisa Thompson Cox from Sheffield Flourish football team. Lisa.
Thank you. Wow, how do I follow all those? Everybody's been doing amazing work, clearly, through the pandemic. And a lot of ours is, because we're a mental health charity, digital charity, we have the Sheffield Mental Health Guide, suicide support and prevention pages, web pages, which are directories. But we also have 7 social enterprises that actually run activities. So at the beginning of the pandemic, we moved all of our activities that we're running, including a gardening session, onto Zoom. We bought gardening materials, so seeds, little plant pots, and they ran the sessions where they would plant the plants, but in their home, and they'd learn how to grow their own little gardens up using their windowsills. We sent out over 500 art packs, care packages, just to cheer people up. So where there was, we knew that there was lots of different organisations that were doing the food banks and a lot more on the ground with the COVID vaccination centres and getting the word out there. We was dealing with a lot more of the wellbeing side, as well as all the other community organisations. But we went to doing daily check-ins with everybody, with all of our members, getting new members on board as well still, and giving them check-ins if we'd not heard from members, or some members hadn't turned up onto the Zoom activities, then we'd be checking in with them to make sure they were okay. Some people only wanted weekly check-ins, but it was kind of like we're a very small team of staff at Sheffield Flourish. We have 7 staff and the rest is volunteers. So we really depend on volunteers to run the Zoom groups. I myself, I had COVID for 7 weeks. I was quite ill. Towards the time that I was feeling a lot better, it felt like a lot of the members, when I was on the Zoom groups, were actually looking after me and checking in with me to make sure I was okay. So the role became reversed. And even to this day, struggling with long COVID, I still get members, because we forget that we've gone from in the office and our boundaries being there to all of a sudden the pandemic happens and we're literally there in everybody's homes, and they're in our homes on the Zoom, on the laptops. So they come up and they go, oh, how's your dog? How's your wife? How's so-and-so? So for us, it was more of making sure everybody's well-being and everybody's anxiety levels were kept low key, but making sure that once the government had given guidelines, we kind of like translated all of that into what we thought was appropriate. We've been back within our building since October, I would say, of 2020. And we was only at a limit, so we limited it because we found out that we could then move certain activities to a limited amount of people, with it being around mental health. And for those who wanted to and felt comfortable, we set up the building so it was all COVID secure. And we had a minimum of 5 people. We've got a big activity room that we could set up to have 5 people, including 1 person leading. But then luckily we've got a smart board where we could do the dual thing, where we'd got the activity running as well as the Zoom group running at the same time. So for the people that wanted to come into the building, we set up an appointment where they only that person could turn up. They had to book to come in, and they felt there was some anxieties there, but they felt really supported that we'd created a really safe environment. And touch wood, we didn't have any flare-ups where we had to shut because we'd caused COVID in any way. So we found that we was doing the right thing. We did a survey just a few weeks ago, which some of the questions were related to how did we do through the pandemic. Just to give a bit of a scope, 90% of the people that answered, and we had over 100 surveys back, but 90% have felt that they'd got improved emotional well-being. 91% felt that they were more connected. 87% developed more skills and interests during that time. And 36% have actually gone on to become volunteers for Sheffield Flourish. 57% though felt that they no longer wanted the virtual meetings. So there's still that mixed where some people are, there's still those anxieties there where some people are still wanting virtual. And where we can do it, we have been doing still virtual. We, as Tom said, I coached the ladies football, which you saw in the video. And we launched that football group at the beginning of 3 weeks before the first pandemic happened. And we had 17 people turn up to that session. So how do you move football onto virtual? We decided to keep people fit, and we sent out fitness packages where they'd got small dumbbells, they'd got a fitness mat, and a water bottle. And we started doing mild exercises online to keep us fit through the lockdown. And then that first session back in April of last year, we had 28 ladies turn up. So we'd actually grown by 10 people. And every single week now, we still run on a Wednesday, and we are still growing. Any Wednesday evening, we have between 12 to 18 ladies turn up. And some of them have been, it's their first activity that they've turned up to since the pandemic. It's because it's outside, it's because it's a safe space. But one other thing that we did through lockdown was, because there was the Black Lives Matter that happened, Sheffield Flourish, and because we're part of SEDACA, we ran the first Black Lives Mental Health Matters conference as well. And we did that in the middle of pandemic, and we had around 50 people that zoomed in on that conference. So we've done a little bit different to other people, but it was around our remit with the mental health. And then where we usually have 2 people manning the support line, we actually had all 7 staff members manning the support line. And some of the people that were calling were actually GPs. There was one day that I had a GP call who was wanting to find out somewhere where they could actually go for themselves to get support around their own anxiety levels. Wow. So the actual change there was actually going from your local community people to actually professionals calling in and wanting some sort of advice. Yeah, so I think there's been some amazing work happening, and I just want to congratulate all of you.
Yeah.
Everybody deserves that.
Thank you, Lisa. It's a really brilliant summary of the work you've been doing, and I know there's more stuff as well from all of you. I wasn't going to say anything at this stage, but I do have to say that the 5 of you have reinforced my belief that Sheffield is a very, very special place. I mean, I've only been here for 45 years or something, but you know, it's just so many creative and wonderful, imaginative and you know, sort of real heartfelt ways of finding out what the needs are and then actually doing stuff about it. I'm thrilled to have heard all 5 of you speak. It's been a very moving time as well as an important information session. So there are a few questions. Judy, do you want to ask your question directly? Do you want to unmute yourself and ask your question? Hi, Judy.
Hi. Well, it was really about the adapting and in an amazing way, as you say, very creative to the situation at hand. But is there any way in which you could say all the awfulness of COVID and having to adapt to it has resulted in a kind of legacy that will go on post-COVID, that will strengthen what you do?
Judy, do you want to direct that at someone first, one of the panelists first, or
anybody who? I mean, it applies to everybody really. So I would say to any panelist who wants to answer.
Luna, do you want to kick off with that one? You're muted again, I'm afraid.
Thank you. I think with COVID, it allowed us to work differently. And I always say, when I know there was a lot of frustration in terms of having to adapt and change the approaches of the way that we work. Within our communities, a lot of our work was face-to-face. And especially when you're working with vulnerable people or the elderly, people with language barriers and stuff. So that was really important. So yeah, we had to think. The encouraging thing I said to a lot of our volunteers and us was think out of the box a lot of the time. So in terms of well-being and supporting people, we use the telephone helpline and use volunteers with different dialects. But I can tell you this, that there were times, and the times that I really did enjoy was when we'd use our folding chairs and took them with us outside the gardens of individuals. There were times, and I called it the red, amber and green light. So if it was a red, if I knew my volunteers or the workers were coming through and there were certain individuals that were on a red light, I knew that we needed to be out there. We needed to connect. And that's why I was saying that it was really important that as community individuals, you're not just sitting behind a desk. My role and many of the individuals that I was working with were finance contracts, were working in the social cafe and things like that. We had to change and adapt and mold our roles. We were doing different things. So yeah, there was a lot of change. Some of the things we still kept. So for example, I still like to go out with some of my volunteers and pull open that foldable chair out in the garden with certain individuals. And I think it was lovely because it connected you all. So a lot of the time we're behind our desks and stuff. And so it was working out of that. So there was the good and there was the bad that came out of COVID. But it's all about thinking out of the box, to be honest. So yeah, I hope I've answered your question.
Yeah, I've just now got that image of you carrying these portable chairs around. That's a really good image. May, have you got anything to say about sort of like?
Yeah, I think reflecting on about both on what Moona said and Lisa as well. I think for us, we, for me personally, and for the organisation and even my friendship groups, we spoke a lot more freely about our mental health, and I think about our well-being, and we checked in more, and we really put it at the forefront of what we were doing. And I've always been, you know, pretty big on well-being within my team and checking in on my friends and family and all of that, but it really made me think about it more and in a different way. I have been working in community and mental health now for like 10-15 years, and there's a lot around the training where you're not meant to self-disclose things, and we don't tell people things, and you know, a lot of people here who've worked in sort of medical field will understand that as well, but that is long gone, and let's hope that that stays a bit as well. I like Lisa, I want people to say like, how are you, how's the dog, like all of that. That was great. That was my favorite thing, seeing pets on Zoom as well. So yeah, I think that's been really good in the way that we work with people, but also the way that we work together on the team and checking in with each other. And I think that's a real positive. We need to carry on doing that.
And Lisa, I think you were just about to respond to the question as well about things that have changed during the pandemic.
Same. We now have, when we're doing team meetings, we now have check-ins. So how are you doing? And it's not just a closed question, it's we really mean it. How are we doing? And we can speak freely about how we're doing. And we have that 5 minutes to make sure that everybody is looked after. But I think what the pandemic's done is it's brought us a lot closer as well to the people that we're supporting and that are coming into our workplaces. That trust us, that because we've all worked so hard to make sure that they are okay through a pandemic, that trust has really bonded a lot stronger, and people are not scared to ask questions anymore about where can we find this, can you help me find this service? And that for me means a lot, that people aren't being afraid to ask us to help them anymore. Whereas we'd see somebody sat in the room, we'd go and try and have that conversation with them. Hey, how are you doing today? You're not looking too good. You're not looking your cheerful self, and you get closed down. Now they're opening up a lot more. And I think that's a big thing where they're feeling more supported. But one thing that I found, because I was the one that after I was a lot better, my role was kind of, because I'm the volunteer coordinator and the community engagement coordinator, my role kind of became a little bit obsolete, where I was having to work from home. I was having to, as Moona said, think outside the box. So I was the one that was delivering the packages, with my wife took up putting all the packages together. She'd got her own little conveyor belt set up. So we'd incorporated family into the work. And then I was the one going out and delivering them. And the shocks on on our members' faces when you knocked on the door, you were stood at a distance and you'd got a little package. We got Sheffield Flourish mugs made, and just a pencil that once you used it, you can plant it and it grows into a plant. There were just little things, to cheer people up. And you'd think the look on their face, it was as if you'd given them the world. Just by being there and handing over that package was like, it was as if Christmas or their birthdays had come all at once. And they were so grateful just for having that 5 minutes contact with that person, because some people, they didn't have anybody to talk to, and you gave them, I was able to give them that 5 or 10 minutes if they wanted to talk and get anything off. I listened, and just that listening was the key point for them. They just wanted somebody to listen to them.
Turns out the little things are bloody big, aren't they, really?
It's amazing.
Yeah.
And just the time, I could have gone and just given them an apple.
Yeah.
And they would have been chuffed to bits with that. You could tell.
Wakas, you were wanting to say something as well.
Just quickly, as everything what's been said, I totally agree with what happened. But one thing which I just wanted to make sure to say about services, how services came together, local community response team, local GPs, we all came together. And as community organization, we always, most of the time we feel we're the end part of referral. When they just can't do anything, they'll send people to us. But this time we actually sat down together, we planned things together, and then we delivered together. And now the legacy of that is that we are seen differently from the workers inside council and others. So we have better relation after. Thank you.
Yes. I don't want to bring a totally political slant onto this, but it does, the work you're describing, all five of you, contrasts enormously to the the top-down planning and the move to privatization that happened during COVID and all that sort of stuff. The big corporations cannot do this stuff. They're floundering to contact anybody, and tried to sideline the primary care services and community groups and everything like this, who came to the fore dramatically during COVID. Carrie.
Well, exactly that, actually. That was what I would have said anyway, because I do quite a lot of kind of campaigning on various issues. And one of the big things has been the privatisation of the NHS, which people, unless they're actually working in the NHS, don't necessarily understand it, because it's been privatised in kind of a contract here and a contract there and whatever. So it's made the arguments for good investment in public services that much easier to put across to people now, because of kind of what's been shown up during COVID, how private doesn't answer. Huge waste of money, and we need investment in our NHS and other public services, and it's become easier to argue that, I think. And just, it's interesting with, so many people have said the mental health and the well-being and everything else, and I think, and especially in the film, the mental mate and the other woman who's, like I mentioned before, in the Four Greens as a volunteer, that so much, I think, in the society, is there a higher degree of mental health now because we're all kind of fractured off and isolated? The whole kind of value of community and the need for community, just for people's sanity and general mental health is so important, isn't it? Yeah. The absolute key thing that community is what we are. We're human. We're community beasts, aren't we? And we must work as community, and we must work together. And it's obviously the way people are talking, from the small things to the way services are pulled together, that community and networking is what gets us through, gets us solving things.
Okay, thanks, Carrie. I think we're just going to almost wind up now, but Joe, do you want to ask your question directly about the long COVID support and what's going on in Sheffield about long COVID? We can't hear you, Joe. You're not muted.
Can you hear me now?
Yes. Well done.
Should know better by now. I thought I'll ask a question because I can pop it down anonymously in the chat. Wasn't expecting to be called upon, but I was just interested really to hear the panelists' experiences of where we're at now. So just, I guess, a bit of a snapshot of what you're seeing within communities now, possibly in relation to the impact of long COVID, and if you're seeing that as an issue, but there might be other things generally as well. Thank you.
Thanks, Joe. Sorry to spring you into the limelight. May.
Yeah, thank you. So two things really. To go back to what I was saying before, the inequalities are still there. They're highlighted, but they're still there. The rapid response and the passion and all the volunteers that we had step up was wonderful, but it's dissipated a bit. And it seems like for a lot of people, COVID is gone, certainly for the government. And, you know, we all know that's not true. So there's a few sort of key points there. The people in our communities are still in the same place as they were a few years ago. And the memory of the work that they did and we did has unfortunately quickly been forgotten by places like the council and the government. So that's another point to make there. And the long COVID, yes, we are seeing people with long COVID, and it's going to be a repeat of things like ME and long-term pain and mental health conditions, in that people are going to have to go and demand help and support, and they're not going to get it. And Lisa will speak to this more than I can, I imagine. And if you've got a good doctor and you've got good access to local services, your experience of having support with long COVID will be completely different. So we're back to the same things, inequalities, and that's the bit that we need to be pushing now in our communities and everywhere else, to make sure that we don't continue to repeat and go forward having another Tory government. Thanks.
Anyone else wants to talk?
I had to get it in somewhere.
The long COVID experience at all within the communities?
I would like to say a quick comment. Yeah. As working with AWRC research project, it was last year. I've seen after that, I've seen few people who have this, and some people, I think we need to have a small project around it, which we have time and effort we can do, actually go back, ask people, because some people don't even recognize this. I'm talking about the communities we serve here, language barrier or other, where they think if they'll ring their GP, what's the point? They won't get through. So that's where all effort finish. I want to get through to reception, leave alone my GP. We need to help them, and the people who are suffering, to recognize and then get into the system. That's what we can do.
I think there's also been a phenomenon about long COVID, but short funding. So the COVID funding, I think, is finished more or less, hasn't it? I don't think any of that's coming through anymore. And that's a bit of a, it's sort of all, it becomes so predictable, doesn't it? The short-termism of the government and pretending it's not there anymore. And we've sort of become habituated to 100 deaths a day nationally. You know, that's what we're expected to think isn't, you know, close our eyes and look the other way, but it is still happening. Okay, any final remarks? Yeah. Or Lisa, please.
If you don't mind, yeah, so one thing that our managing directors said is that we dealt with the pandemic. We all did a great job with that, but what we're dealing with now is the aftermath, and the amount of anxieties and the long COVIDs that's out there. A lot of our staff who have had COVID and members who have had COVID were like, the amount of times, I think I must have sounded like stuck record. I was saying to certain staff, don't think that you're going to be okay straight after you having COVID. You're not. You don't go back to the gym full whack like you usually do. And it wasn't until they tried that they were like, you were right, you know. I can't do it as much. And I'm like, I've not been complaining about my own health for nothing. I'm not a complainer. I keep it quiet. But for me, I have short hair anyway, but I had alopecia. I have constant tinnitus. So I don't have no let up in my ears. I have constant ringing. I've lost 25 decibels of hearing in my right ear. I used to be able to swim a mile every day, and it used to take me 45 minutes. Now it takes me 2 hours to swim that mile. And it it is a struggle. It is a struggle, but I'm now back to swimming. I do it in moderate paces, but it's not a myth, and the long COVID is out there. And I just want to reiterate that it is out there, and I can see Cass nodding because I'm sure you've seen plenty of people in your community coming forward and saying, I've got these symptoms. And I do think that I went to my local gym and I noticed that there was a long COVID group. I said to them, how do I get onto the long COVID group? And the woman behind the counter turned around and went, you've not got long COVID.
Yeah.
And I was just like, pardon? I went, how do you know I've not got long COVID? She said, because you're swimming. I said, I have long COVID. And it wasn't until I had to explain to her, I was seriously ill for 7 weeks at the beginning of the pandemic. And I'm still struggling now, but people think you can see it.
Yeah.
And,
repeating pattern, someone said, didn't they?
Yeah.
About the repeating from the ME experience, really.
Totally. So to answer your question, we are going to be dealing with long COVID, I think, for a long time, because it hits everybody differently in different ways. But you can get there, and it's took me 18 months to get to wanting to go back to the gym, but I'm now there. So as long as I'm doing the little bits, we can do it.
Thanks, Lisa. I think this is time to wrap it up now, really. But I'd really like to thank the 5 panelists, and your organisations are just, again, a snapshot of the many organisations within Sheffield who've been supporting people over the time of COVID, the pandemic times. I love you all, actually. As it happens. Fantastic. I'm left with several images. I'm left with the image of Muna with her chair, and the pencil that grows into a tree, and the GP ringing up for help from a community helpline, etc. So those are things that I've taken away. But many thanks to the panelists and for everybody who's been attending as well. So thank you so much, and thank you very much, Johnny, for doing the technical stuff, and my apologies again for probably my inadequacy at the beginning of getting online quickly enough. So thank you, everybody, and thanks, Johnny.
And huge thank you to you as well for hosting, Tom. Fantastic event, really interesting and wonderful insights. I've just put a quick link to the Festival of Debate website. If there is any events that any of you would like to join, please do engage with them online, or even better, in person if you're able to do so. But yeah, as Tom has said, a huge thank you to all of our panelists this evening, to Carrie, to May, to Muna, to Wakis, to Alice, and to Lisa. We will hopefully see you all again soon.
Excellent. So thank you so much, everybody.